Okay, so for this video, we're gonna do a less stressful, hopefully less painful and less difficult and less tight and complicated version of upward and downward rotation of the scapula. Well, it's not a true eccentric. It does involve concentric eccentric components that have to be managed, but we don't have the complication of this all going on because you're gonna be bent forward over a table or counter and not having interference of having to deal with gravity in that way. In fact, we're gonna be using the muscles back here, which we actually want, with the shoulder blades in a much better position back here where those muscles are shorter and not overly stretched where they can't really function very well. So I'm gonna come around the table here on the other side and you can see how I'm doing this. All right, so here we are, a nice flat table here. I'm going to take my good arm here, my left in this case. I'm gonna put it down out in front, like a cross like that. And just kind of like a genie pose, I'm gonna take my other arm and kind of bring it on top, not on my arm, but ahead of my arm. And I'm gonna sink down in my hips so I feel like I'm pretty well supported by my legs. From there, I'm gonna tip my head, tuck my chin, look straight down, make sure my neck and everything and head are supported. And I'm gonna think about this motion as I'm forward facing downward now towards the ground in a more L shape here. And I can think about here. Now I can even bring my fingers if I need to because I got my elbow on the table, provided you can tolerate that. And I can kind of feel that motion there, or I can just keep my arm there and just try to feel it as is from my actual shoulder, which you should be able to do because it should move pretty freely here. So that's a good way to work that. Now we can also tie that in with some of our other progressions as tolerable and as appropriate. So I can take my hand here and I can bring it here. And I can actually kind of work with rotation a little bit here as well. So again, the combination of extension through your torso, your thoracic spine, the rotation of your thoracic spine, and upward downward rotation of the scapula. You can also bring it forward backward, preferably back. But those things should all kind of work together to create a pain-free and fluid and controllable dynamic of use of your arm. So this is just a means of giving support where I can work that dynamic of extension, rotation of my torso with stability and support here, stability and support here, and then trying to move not just my elbow here, but move from my shoulder blade, upward rotation, downward rotation, and then try to bring those things together without pain if possible or tolerable. Good.